Hi friends, welcome to Tuesdays with Elizabeth. It's nice to be back again. I will be sharing with you some information on certain conditions which are very commonly seen amongst children. And today I will be talking about toe walking. Now, what is toe walking? As the name suggests, it is simply a pattern of walking where the child walks on toes without maintaining any contact with the heel. So it's something like this. So what are the reasons for toe walking? Now, before we go on to the reasons, let's understand the mechanism behind the muscle work. So, heel lifting action, something like this, okay, is done with the help of the calf muscles. And these calf muscles have extension into a tendon which is known as tendoachilles, which inserts into the heel. Now, if there is any tightness of the calf muscles or the tendoachilles, then the child will toe walk. So this was one reason. The other reason could be just because there is no reason. Well, it's habitual. A lot of children walk with toe walking in the early ages of life, and then they just continue to do that. The other reason would be medical reasons. There are some children who have conditions like cerebral palsy or autism. They are likely to toe walk. A lot of them also have hypersensitivity of the sole of the foot. And there are some who may have front ankle muscle weakness because of probably some nerve injury. So in all these conditions, the child is going to toe walk. So now that you know the reasons, what next? What is the treatment? Well, it is seen that habitual reasons, tightness of the muscles, and hypersensitivity of the sole of the foot show good results. But it all depends on when the treatment has been started. So, the earlier you notice toe walking and the faster the treatment is given, the better would be the results. So I'm going to show you some activities today which will be helpful if in case your child is toe walking, and you can do them within the confines of your house and you don't really have to go anywhere far to do them. So here they are. So you can ask the child to stand on a slope, something like this, and then ask them to reach forwards. So this will help in stretching the calf muscles. The second activity would be walking uphill. You could ask your child to just walk up the slope, something like this, and take baby steps there. Small steps up the slope. Now in this activity, you can ask your child to cross over an obstacle. So all these exercises will activate the muscles in the front of the ankle, and that's very important to avoid toe walking. You could try these tips, and these are some of the activities out of the many things that we can do for toe walking. However, if there is persisting toe walking, and your child is beyond 2 years of age, then it is advisable that you consult a physiotherapist and a physician, because it simply indicates that your child needs much more than basic activities. Next week, I will be talking about another condition and sharing some information with you. So this is all for today. Stay tuned.